Okay, so we've got Isaac here, and he's just been having some osteoarthritis issues with his knee. So we just finished a treatment with him, and he's having some pain in his knee. So we're going to do some electric stimulation just to help with that pain management there. So the first thing, obviously, just pain in the knees, about a 5 out of 10. So that's our indication there. Um, some contraindications we need to be aware of is vasculature in there. Make sure he doesn't have any history of like thrombosis or I mean if he's hemorrhaging that's a whole different thing. But I think we're okay there. Sensitivity. He seems to be somewhat cognitive here. Seems to kind of know what's going on. So we're not having any contraindications there. Not in any vital areas, just on the knee there, so we don't have to worry about organs, pacemakers, anything like that. Um, so after that, I think we'll just jump right into it. So Isaac, basically what we're doing here is we have a modality, is what it's called. It's a form of treatment.
Okay.
And so what it's called electric stimulation. This name might sound kind of scary, but basically what we're going to do is just going to send a few electric currents through your knee, and it'll help actually relieve some of that pain. And what we're going to do is actually called a low frequency TENS. And what that means is we're going to have contraction about every 10 seconds, and you have a 30-second break, and it'll be a little bit more, you'll feel a little more sensitivity, more sensation there. But what will actually happen is you'll release something called opioids, endogenous opioids, which a lot of people know opioids is like a drug you can take. It'll help you, just like pain relief, but your body actually has a system of doing that as well, and we just have to cause a little bit of stimulation. So in essence, we'll just be giving you, some natural pain relief there. Okay.
Okay.
All right. Cool. So if that's all right with you, we'll inspect that knee. You're not having any sensitivity issues here. You feel that all fine.
Yep.
Perfect. Good. And so are you comfortable with this treatment then?
Yes.
All right, perfect. So we'll have a couple pads we'll stick on you, and then we'll set you up to the machine, and we'll get you going. Okay. So first, we'll take you with us here. Actually, we'll sit you here. So I'm gonna get the pad situated here. So if you want, you can lay down just to be most comfortable here. And we'll just stick the pads right here on his knee. We'll just get him kind of here. We want to be able to see a muscle contraction, so we'll just get him on the distal quadriceps, vastus medialis, and lateralis here. That way we can kind of view that we're getting a strong enough stimulation there. So we got him on both sides. Right there. Looking great. Super comfortable. All right. So on here, we've got this guy set up. As I said before, we're going to do some low frequency. So we want to we're going to do about a 20-minute time. And then for the rate, I wanted about 10 pulses per second there, just to make sure that it's not too much stimulation. Width, we're going to do 200 microseconds, width being the frequency of the pulse there. And so we got that set up. We're going to do 10 to 30, so he gets about a 10-second contraction, and then some relief for about 30 seconds. But 0.5 ramp, normal. And so what we're going to do next is I'm going to put him on, we're going to plug him in, and we're just going to increase the intensity so we get a visible muscle contraction. And then once he's about comfortable there, we'll stop, and then we'll just do that for about 20 minutes. So hopefully we can see again a contraction here. Sorry, we're using a laptop because we're very video handy here. So gonna get this guy hooked into you.
Has he even looked at any of yours yet? He looked at my first one.
I think he's gotten to 2 of mine.
He's got to my first one.
Okay, Isaac. So I'm going to start increasing the intensity here, and so we just want to see a little twitch here. I'll be watching, but if anything starts happening where it's too painful or anything like that, just holler at me and we'll stop. Okay? But it shouldn't. There shouldn't be anything going on.
Should it be painful?
No, it should not. You'll just feel a little wiggle.
So I want you to ask you got me on. I just got a little bit backwards, but can't attach to the video.
Yeah.
Watching there. On that. Okay, let's just see if we can get a bit of a visible twitch here. Let me know if it gets too bad. You doing okay there?
Yes.
Okay. Definitely feeling it. Okay. Let me know if it gets too painful. Should be seeing a contraction soon. Very interesting to watch, I'm sure.
See it?
You can see it?
Yeah.
Let's check.
Not so much anymore now.
Okay. Teasing me here.
Just on the fastest medialis I can see.
Okay. Get you just a tiny bit more. Holy smokes. So we kept it lower so we could keep it around the knee just to try to keep it more in that area. There's probably not a ton of motor nerve endings there. There we go. How's that feeling? Is that okay?
Yeah.
We got 2 twitches and it stopped. Okay, yep. So we got a couple. There we go. Yep, you might be able to, hopefully you can see it. It's a very light contraction. So we'll go ahead and we'll start you on that. And video purpose, we'll just do it for about 30 seconds.
Oh man.
You all right?
Yeah.
Okay. All right, and it should be relaxing here. Getting the relief there.
Ooh, now it's off.
Okay. And is that all right, or is it too much still?
No, that's good.
All right. Sometimes you get patients that are kind of wimps, so you just gotta go with that, but they'll be all right.
Not me, doc.
Not me, Doc. We'll let you do one more contraction here because you enjoyed the first one so much, and then we'll turn it off here.
Guys, just practicing.
Yep.
Okay, we've got 2 new high-lows that we need delivered.
Okay. And so we'll go ahead and turn that off here.
So,
Okay. And so he's done. So the next thing we'll do is we'll just pull these guys off. Isaac, how you feeling here?
Pretty good.
Pretty good. Skin looks good. So we should. The good thing about this treatment is it lasts about 4 to 6 hours. When you go home, you should be feeling relief throughout the day for a bit there, and you don't have to have anything stuck to your leg for the rest of the day. Okay. All right. Good deal. Hopefully that helps, and we'll see you next week. Okay.
Thank you.
Yep.